The purpose of this podcast is simple. We want you to get to know your doctor before meeting them in person, because you're making a life-changing decision and time is scarce. The more you can learn about who your doctor is before you meet them, the better that first meeting will be. I'm your host, Eva Shea, and you're listening to Meet the Doctor. Welcome back to Meet the Doctor. My guest today is Dr. Whitney Wolfe. She's a double board certified family medicine and osteopathic manual medicine. I'm sure I screwed it up.
You did good.
And she has a wonderful med spa called Premier Spa of Murray, which is in Kentucky. And I've been informed that's in Southwest Kentucky. Welcome to the podcast.
Thank you so much for having me.
Okay, so let's start with that board certification you have is an unusual combination. And so what does that mean and how does it help women?
So family medicine, I chose that specialty. I love being a jack of all trades. I wanted to be able to deliver babies, take care of babies, and do everything in between. And specifically, I wanted to be able to work in rural areas and be able to provide whatever services are needed. Beyond that, I'm a firm believer in just how everything in the body is interrelated. Everything works together in one system. And so my osteopathic manual medicine board certification, basically, I specialize in how the body is aligned. So that's everything from your fascia, that tissue that connects your whole body, all of your muscles, all of your bones. And here at the spa, I do a lot of treatments when it comes to hormones. Lots of menopausal patients or perimenopausal patients, lots of pelvic floor rejuvenation. And for me, if a woman comes in and I'm evaluating her pelvic floor, I'm also looking at not only how strong of a Kegel or how good of a Kegel she can do, but how that pelvis is aligned. Because if her pelvis is out of alignment, she's going to have a leg length discrepancy. She's probably going to have some low back pain. She might have knee pain. It's all connected. And so I just love looking at somebody as a whole from the inside out and empowering their beauty however I can.
How is this different from chiropractic, which might be something people are more familiar with?
Yeah, absolutely. You know, chiropractic, I feel like so many people think of that as kind of like that pop and crunch. Not all chiropractors, approach it that way, but that's a very common way. It's kind of a level beyond that, because we have we have a lot of different modalities. So we have ones that can do kind of neuro reprogramming of the body. So not only do I, pop it back into place, but then I also work on training your muscles to hold the body back in that correct position, which can take some time, especially if you've been out of alignment for a long time. And everything, I've done training in acupuncture and craniosacral myofascial treatments, all sorts of things like that. And kind of the idea that your body holds on to the various traumas you've gone through. And when it comes for taking care of women, having a child is an amazing process. It truly is. Whether it's C-section or vaginal, carrying that baby changes every aspect of who you are. And no matter how you have that baby, you're going to have some sort of scar tissue. Your body is going to somehow carry that memory on. And so, as women heal and recover from that, and then go through all the hormone changes of that, I'm looking at not only are your hormones balanced, but is your entire body balanced, physically aligned.
How do you approach that kind of evaluation with somebody that you have not seen before? Does it take some time?
Oh my gosh, yes. And my staff would tell you I'm always running behind because I talk to my patients so much. If they come in and 10 times out of 10 times, they're always saying, I've just been told that I'm normal. And, my primary care says I'm normal, but I feel this way and I have this going on, and so I just ask them a whole bunch of questions. And, in medical school, we're trained that if somebody's labs are within normal limits, the low end and the high end, that's totally okay. We're trained, it doesn't really matter where they are in that, and so for me, normal is not optimal. And so we have that whole conversation. We start talking about hormones. And then if we're, having symptoms of back pain, knee pain, vaginal dryness, incontinence, whether it's urinary or fecal, loss of sex drive, all of those sorts of things, then we kind of start talking about the pelvis floor. And if we start those treatments, that's where my evaluation comes in.
Do you find that women think this thing is just happening to me, or this is a really weird symptom? Like, do we sort of come into that conversation thinking that this is just me?
Yes, because I think society tells women that it is just them or that they're crazy for feeling that way, because most of the time they've seen other doctors that, negate their symptoms or want to treat them with an antidepressant because they've had loss of interest and aren't interested in sex and, gaining weight and all of this stuff. And so they'll just like put a Band-Aid on the problem instead of getting to the root cause, which is oftentimes hormones and diet and exercise and sleep and all of these things that are so easy to talk about and hard to do.
I just read a weird one that frozen shoulder was caused either by hormones or a virus. And I was like, well, which one? Have
Huh.
you seen anything like that?
I haven't seen anything like that. I do think that hormones have a lot to do with how all of the tissues in your body function, though. So like if you don't have testosterone, which really after the age of 35, your testosterone drops off at a very rapid clip, like you're not going to be building muscle, no matter how much you try to work out and gain that muscle back. And so if you've injured your shoulder and then you're losing that muscle, and then you're not moving and using it as much, it's kind of this horrible self-propagating cycle. And so I'm sure hormones have something to do with that. Is it totally attributed to it? Probably not. A virus, I don't know, can cause a lot of muscle aches. So I'm sure that can contribute as well. But again, probably not the whole thing.
What other kinds of weird things do you hear about?
I mean, I hear about everything under the sun. I would say the most common thing, though, is women, they just come in and they just like they've lost their zest for life, which is so depressing to me because, nowadays people are living to 80 years old commonly. And so if I have a woman that's come in, and especially after having a second child, there's a huge hormonal changes that really happens at that point, like comes in and just has lost that zest for life, that desire to just do things, is feeling just so worn out, doesn't have any energy at all, no
Why the
passion
second one?
anymore.
What did the second one do to deserve that distinction?
I don't really know physiologically. We just know that it happens, and I think some of it might have to do with the timing, because especially if they're very close together, which is a very common thing, it just seems to take a more profound effect on the body. I think a lot of it is you don't fully replete back to what would have been your normal before your first baby. And then life just gets so much busier too when you have two kids and marriage. And if you're working, I mean, it's just life gets crazy. And so, if that starts after the second child and then you live for a couple of decades, let's say 18 years, taking care of those kids, just slowly getting by. And then all of a sudden you find yourself in my spa, not feeling good, and you don't know why. And no one's been able to figure it out or tell you, give you any good answers for 18 years. I mean, I've had women just weep, when they talk with me, and I tell them, you're not crazy. I think we can solve a lot of this when it comes to just hormones and what you're eating and how you're sleeping and how stress is impacting your body.
So when you go through that evaluation process, then what's the next thing that happens?
So we just kind of talk about, those symptoms. I hear my patients and really validate where they're coming from. We do blood work, and then we figure out from what that blood work shows me kind of what hormone supplementation they need to reach their optimal levels. And I do estrogen and testosterone and progesterone and thyroid. I look at, DHEA, which is not a prescription here in America. It is in Europe, but then vitamin D and B12 and, try and figure out everything about what they're eating and their bowel habits. And do I need to work on like pro and prebiotics and all of those sorts of things? So I normally try and get that optimized. And then if they're also having pelvic floor symptoms, particularly vaginal dryness or urinary leakage, if those issues or the dryness doesn't really get better over time, then I start talking about pelvic floor treatments. And we begin kind of that treatment process. Normally, those treatments I like to do in a series of 3. And then I recommend like a maintenance treatment a year later. I'm a firm believer, about 50% of your core strength comes from your pelvic floor. And so oftentimes, even after doing that treatment series, I'll still bring them back to sit on one of the chairs I have here. It's called an Imsella chair, and it does about 11,000 Kegels. And so I'll just continue on them on that once a month or once every 3 months, just to help maintain everything we've worked so hard to kind of build back. Not to mention that core strength, which helps with everything from sitting up or taking in your groceries or picking up your baby or a grandchild, all of those things. My goal is I want my patients to reach 80, 85 years old and be strong and confident. That's all I want.
You and I have a mutual friend, and it's through that friend, who's also a doctor, that I learned quite a few things I did not know about the pelvic floor.
Yeah.
And I remember when I went off and learned about it and came back to him, I said something like, anyone who does not believe there is a God should look at how the pelvic floor is constructed.
Yes.
Right?
Yes. If you think about it, just like the sheer metrics of it, your average baby's head is 9 centimeters. The average opening, like to your pelvic outlet rim, is 10 centimeters. So the fact that you're within 1 centimeter, through that whole process of like delivering a child vaginally, and then that everything bounces back and you continue to like function and not have any issues and your organs aren't falling out. It's miraculous. It really is.
It is.
Yeah. Mm-hmm.
What kinds of things do you think we don't generally know that we should know about the pelvic floor?
I just don't think anyone understands how important it is and what a toll it takes in our normal life. I oftentimes talk about just the weight of your internal organs, whether you're male or female, like all of that weight over time, you have that pushing down on your pelvic floor. And then thank you, gravity, also all of the weight of that. And then you're supposed to like keep all of that supported for your entire life and not have any issues with urinary leakage, sexual function, all of these things. And so I wish people would focus on the pelvic floor, even if it was just a smidgen of the amount that we focus on the glory muscles, like biceps, triceps, deltoids, things like that. I'm like, if we could just reallocate some of that passion to the pelvic floor, that would also be really good, because it truly is like the center of all you do. And it's so sad that it's like we just ignore it until it becomes problematic, and then you have urinary leakage. But it's like, if you're having those symptoms, that to me, that means all of your tissues have also stretched out and they've thinned out. And as a woman, that means everything, like you're not getting that same mechanical stimulation that's needed for you to have a pleasurable sexual experience. And like life is short. You should be enjoying it no matter what your age is, and so so many people are cut short of that, and it's sad.
It is sad.
Mm-hmm.
I think the thing that shocked me the most was that if you injured it, like let's say it stretched too far or even didn't bounce back at all after you had a child,
Mm-hmm.
you would not be able to feel that. And so
Mm-hmm.
for a lot of women, it goes completely undiagnosed and untreated.
Mm-hmm.
I think the average was for 16 years or 14 years.
Mm-hmm.
You just wouldn't even know.
Yeah.
And so you could be doing Kegels every day. And there is a point where you can tell me if I've got this wrong or right. But there's a point where you can't do anything. Like you actually have to get it treated in order for it to come back.
Yep.
Yeah.
Yep. Absolutely. Because the reality is in healthcare, we don't teach women how to do a Kegel. We just say, stop your urine, like which
at a stoplight.
Yeah. Like, how does that even work? And so it's like, here you are as a new mother with a baby. You've just had a horrific tear, because like at least 80% of women with their first vaginal delivery have a significant tear, and so it's like, if you have a tear, you go home on ibuprofen, which is going to decrease your inflammation, which means your scar tissue is going to be more pronounced. And then we just tell you, hold your urine. Like, you can't feel anything. You're stressing out all the time. You're trying to breastfeed, so this is a thing that affects all women. And it starts from such a young age. And then it just is sad because I don't even normally see them until, my favorite patients are when they come in and they're 60 or 70 years old and they're like, I just want to get my life back, or they're out dating again, because, and they're like, I'm so embarrassed. I don't want to leak while I'm on a date or worry about wearing Depends, or coughing or sneezing too much, and so it's like I get the hormones right and we get the pelvic floor right and then get their confidence back. And then they're like, oh, what can I do about like this wrinkle or like a little brown spot over here? Then we transition into all the fun lasers and toxins.
It's a slippery slope.
Well, it's just so fun to see women. It's like they truly come back to life again. And men too. I do tons of men. So
this happens with weight loss too.
Yes.
If you lose a lot of weight or even a little, like you start feeling better after just a few pounds.
Yeah. And that's something I do here too. I do weight loss medications and I microdose all of them, because I find, if people are coming to me for weight loss, that usually means that their insurance has not covered that medication, which means they're not a, diabetic with heart disease, with high cholesterol, all of these pre-qualifications that insurance requires. And so it's like, if you're coming to me, normally you don't have a huge amount to lose. Like I typically see 50 pounds or less, and so it's like, if we just microdose just a little tiny of that weight loss medication, it's just enough to empower people to turn off that food noise so they can be a lot more mindful about what they're taking in. So that's when I'm talking with them about, increasing their protein intake and making sure they're getting plenty of fiber, and just slowly changing those little habits so then it becomes sustainable when they come off of that medication.
When you are microdosing, we're talking about GLP-1s and probably compounded versions.
Yeah, and I don't do a GLP-1, I do GLP-2s, and I do a GLP-3. And the GLP-3 that I use, retatrutide, it's not even FDA approved. It's currently in the trials. And I tell my patients that when they come in. But, it also hits the glucagon receptor. And so I feel like it's a little bit more powerful at maintaining a steady state of glucose in your body while also protecting your skeletal muscle. Because for me, again, like I said, I want my patients to be 80 plus years old and be strong and confident. And so if I have them on a weight loss medication and they start losing skeletal muscle, I stop that medicine or I decrease the dose. I mean, I'm always checking their body composition because to me, losing 10 pounds is not worth losing your strength. Because then that affects your functionality. And again, that gets back into my board certification in osteopathic medicine. Because then I'm like, then you're losing alignment and movement and all these important things.
Can you move to Austin?
Yeah, sure.
How do you check for body composition? Do you monitor that with something in particular?
Yeah, I have a scale. It's called an in-body scale. And so it works based off of impedance. So it basically sends an electrical signal through your body and it tells me how hydrated you are, your percentage of skeletal muscle mass, your percentage of fat. It also adjusts it based off of your age and your height. So you're getting demographic based information. And so any of my weight loss clients, I have them come in at least once a month to stand on the scale so I can evaluate that and look at their skeletal muscle mass. That also helps me calculate their basal metabolic rate and like how much protein they need and everything to maintain that while they're trying to lose weight.
Not saying how I know, but you can cheat on an in-body pretty easily by like putting change in your pockets or
yes. And I mean, I don't like heckle my patients, that bad. I wouldn't be like, oh, you need to strip totally down to stand on this scale, but I do try and
where I was going with that was how do you make sure that the conditions are the same every month so it doesn't
I mean, to some extent, I expect a little bit of error in that analysis. It's one of the best scales out there on the market, but there's nothing that we do in medicine is perfect, and so I have them take off metal jewelry, take off all their shoes. Ideally, they shouldn't be wearing jeans. I like to have them come in about the same time of the day, all of these things. But, also life happens. And so
Yeah.
I always expect, a pound or two fluctuation in there. And the scale automatically actually takes into account about a pound of clothing. But sometimes it's more than that, especially going into the winter. So,
I did it when I was about to do the Orange Theory Transformation Challenge.
yes.
And I went and read like how do you cheat so that you weigh more at the beginning so that when I got to the end I would have an extra boost of weight loss.
Yeah.
And then right in the middle of this, me trying to trick the scale, which really speaks to who I used to be pretty well, a doctor told me about semaglutide at the time.
hmm
And so then this was almost 3 years ago, I
hmm
went down that road and was very successful.
hmm Good for you. Did you make it through your Orange Theory classes?
No,
Those are
no.
so hard.
I did really well the previous year. I think I lost like 16 pounds,
Yeah.
but somebody else beat me. And
Yeah.
probably because they were cheating.
Yeah.
No, I don't know if they were cheating, but
Who knows? But good for you for trying. I mean, those are very
I
intense
tried.
classes. Whew.
Oh yeah. I mean, it's actually pretty easy to do it at your own level.
Yeah.
I think the most important thing is that we got to do something. Like
Yes. And
anything is better than nothing.
that's what I always tell my patients. I mean, like just today, one of the things I do love about the InBody scan is it gives you measurements for each extremity, which gives me a lot of information because if there's an imbalance between, let's say, your right and left arm, that means you probably had the injury is somewhere before, which again cues me as an osteopathic physician, like, okay, where is that injury? How is that affecting your day to day life? But like today, I had a patient who on the left side was much more weak than on the right side. And the patient had a shoulder injury and all of this stuff and is very, not active, doesn't move a lot, is very intimidated by the idea of going to the gym. So we were talking about, okay, if you're right handed, you probably, when you open the refrigerator, pick up your milk with your right hand, or you probably carry your purse with your right hand. All these things you naturally do
Yeah.
with your right hand. And I'm like, if your left hand is weak, I want you to start doing those day to day activities with your left hand to try and build that strength back up. And so for me, it's thinking like that, like things that you can build into your day to day life, to recover strength from an injury. Like start there. Don't start by joining a gym and planning on going 5 days a week all of a sudden. Like that's impossible to maintain. So,
Yeah,
yeah.
you wouldn't get very far. You might make it
Yeah.
for a day or two before you were
Yeah.
like,
Like I'd love it if we could all do that, but that's just not reality. So I just whatever gets people to move, I'm happy with.
get outside in the sunshine.
Yes. Yes. It makes such a huge difference. Like there's a half a mile loop I do in my neighborhood every day, no matter what the weather, no matter what is going on at the spa or the hospital or whatever. Like I have to do that for my own mental health. And I just walk at a pretty fast clip, but I just walk, and it's for my stress, it's for anxiety, it's for setting my mind to do its best during the day, all of those things. And yeah, it happens to get my heart rate up and maybe burn a few calories, but that's also not why I do it.
Take us through all the services and in particular what technology you have there in the spa. I'm really curious.
Sure. We have a lot of technology. So we have the Empower device, which is an in mode device. And that's what Dr. Ramirez had developed, the Aviva aspect of that. We don't do Aviva here in our practice currently, but I do the Morpheus 8V, which is the vaginal and vulvar microneedling. I do Formav, which is the vaginal radiofrequency. So I use that a lot when it comes to vaginal dryness. V-Tone, which I use when I'm really trying to kind of neuro reprogram somebody how to do a Kegel, and I'm teaching them as I do that. If they don't need that, then I'm using our Emsella chair that does Kegels for them. I do like that. That activates your glutes and your hamstrings a little bit. And I have a lot of men that come and sit on it too, because we do the sexual wellness function, which really helps, especially after prostate surgery. Beyond pelvic floor and vaginal rejuvenation, we do a lot of body sculpting. So I have the Cool Sculpting Elite. So we do all of that, which is great, for freezing specific areas of fat. We'll especially use it after weight loss. Like somebody might get down to their ideal weight, but still have pesky fat on their arms or an area of the belly that doesn't go away. And so that's when we'll kind of cool sculpt. I'm normally combining my cool sculpting with M-Sculpt Neo as well, which is that same technology as my fancy chair in that it uses a strong magnet to activate all of your muscles. So like if I treat an abdomen, it's equivalent to doing like 20,000 crunches, and so if I have a patient who has lost weight, but has a pesky area of fat in their belly, I'll cool sculpt it, but then I'll M-Sculpt too to try and gain their strength and address that fatty tissue. I do a lot of Morpheus 8 when it comes to the abdomen, because we were talking about that. I have a lot of women who come in after a C-section who hate their kind of shelf that they get above their C-section scar. And so I'll often cool sculpt above the scar, and then I Morpheus over their C-section scar. And it kind of frees up that tissue, so it helps flatten things out. I love Morpheus 8. It's like my top selling thing. I do it all over the body. It's that, microneedling procedure. And I normally combine it with a laser, depending on where I am in the body. So in the face, I'll combine it with an ultra laser to deal with reds and browns. In the extremities, sometimes I'll combine it with my Clarity 2 laser, which will help then just with more collagen production, or if people have spider veins or things like that, it will take care of. So yeah, we have those as 2 lasers as well, which helps with, skin quality, texture and tone, veins. It can do warts of all things. I haven't done many of those. We do lots of acne treatment packages. So like for deep cystic acne in teenagers, their parents will bring them in and they'll say, we really don't want to do Accutane. Can you help? And so we'll just do some laser treatments and get that deep acne addressed. And then we also have the hydrofacial devices, so that's like a medical grade facial as well. So lots of technology. It's pretty amazing what we can do nowadays with technology and medicine.
You can't certainly be doing all of this yourself. So tell us
Oh,
about your team.
no. My team is amazing. I am like the luckiest person alive to work with this amazing group of women. So there's 11 of us total. And we calculated this just today, actually. We have 144 years of clinical experience combined. And so we have people from every different background. I have some who've been doing in medicine for a handful of years. And I have a nurse who's been in medicine for 33 years, and so I love having people, here in every walk of life. And so there are 2 nurses, a PA, an APRN, 2 estheticians. I have an office manager, front desk girl, social media. I mean, we have everybody, and it's just such an awesome group.
If I am listening today and I am curious about making an appointment or finding out more, where should I go to find out more about you and your wonderful team?
If you just want to kind of read about our services, you can always go to my website. That's murrayspa.com. You can give us a call, or from the website, you can book an appointment. I do free consults. So it's 45 minutes of my time where I just sit down and focus on my patients, and I don't charge for that because I think it's so important for people to be heard. And I talk so much, so I know that I need that amount of time.
It's for you.
It's for me. And then I'm super passionate about just like educating people and getting the word out about what we do, because I think there's so much that we do that can just help the general community. So the spa's social media page, Premier Spa Murray, on Instagram and Facebook, and then my personal page too, Dr. Whitney Wolfe. I am always making videos. Like every day I post an educational video, and I come up with those videos based off of questions that patients ask me. So normally questions that I get a handful of times, I just keep a list in my phone, and then I try and do like a whole bunch of things kind of about that same topic within a week or so. So I'm always just trying to get the word out. So
what do you like to do when you're not at work?
I love music. I come from a music background. Actually, I started out my undergrad as a viola performance major and ended up being a viola minor. Music has shaped everything that I do. I've always been extremely good with my hands and very fine movements with those. And so, as an undergrad, I went from doing that to then studying music in the brain and how the brain processes sound. And I was a prep surgeon for many years for the Institute of Neuroscience at U of O, doing surgeries on these little tiny mice. And I thought I wanted to be a neurosurgeon, actually, because that combines my love for science and my ability with my hands. But then I just, realized like I want more of a life than that. And I love being a generalist. I want to, empower these small communities. So needless to say, I love music. It shapes everything that I do. Give me any type of music and a nice glass of red wine. That's like my perfect night, especially when I'm out on my patio. I love that, but yeah, I have some good friends, so trying to hang out with them, and I'm always out. I plant a lot. I have a big garden and a big yard, and so it's just simple things like that that I love.
I don't think that I've ever met another violist that was a doctor, much
So
less
crazy.
had one on the podcast. So
It's so
that's
crazy. There are not
the
many
coolest thing.
violists in the world, and I always have to explain that it's a big version of a violin / a small version of a cello, because no one knows what that even is.
Nope.
So it's crazy to be talking to somebody who knows.
Yes, I know. I got a gig. Someone texted me yesterday and I looked at it and I went, oh no, now I got to practice.
Yeah.
I have like 3 weeks maybe.
Mm-hmm. You can do it.
I just have to put it back in the routine.
Yes, you can
for
do
a
it.
little
You just
while
got to
so
ramp
I
up.
don't. Yeah. Yep. It really has been a pleasure to get to know you today. I'm so glad that Dr. Ramirez sent you my way.
Oh, well, thank you so much for taking the time to talk to me. It's been so delightful and odd how our worlds have kind of coincided in some different ways and we didn't even know. And I hope our path crosses again, sometime soon in the future, maybe even in person. Great.
I hope so. The website is murrayspa.com, and we'll put all of the links in the show notes to make Dr. Wolfe very easy to find.
Well, thank you so much. I appreciate it.
Thank you.
There's no substitute for an in-person appointment, but we hope this comes close. If you're considering making an appointment or are on your way to meet this doctor, be sure to let them know you heard them on the Meet the Doctor podcast. Check the show notes for links, including the doctor's website and Instagram, to learn more. Are you a doctor or do you know a doctor who'd like to be on the Meet the Doctor podcast? Book your free recording session at meetthedoctorpodcast.com. Meet the Doctor is made with love in Austin, Texas, and is a production of The Axis, TheAxis.io.